Okay, now we're going to move to the cranial nerve assessment part of the physical exam. Cranial nerve 1 is the olfactory nerve. That's the sense of smell. So I'm going to ask the patient to go ahead and smell this alcohol prep, and if they can smell that, that's a good exam. Next, we're going to move to cranial nerve 2. This is the optic nerve. We can first test gross vision, which I will infer by pupillary response to light. Very good. Very good. The pupils respond to light, so that's gross vision. And then we're going to check visual fields by confrontation for optic nerve 2. So go ahead and cover your eye and tell me when you can see my fingers move. Okay? Okay. Okay. Okay, very good. Other eye. Look straight at me. Very good. Very good. Very good. Very good. That was visual fields by confrontation. Next, we're going to move to checking the 6 cardinal directions. This is going to assess cranial nerves 3, cranial nerve 4, and cranial nerve 6. So I want you to go ahead, stare at the pin, and just follow my pin. Don't move your head. Okay, very good. And with this, we check cranial nerve 4 is the superior oblique muscle, and that's when you're looking down and in. Cranial nerve 6 is the lateral rectus, which is looking out, and all other cranial nerves are cranial nerve 3. Okay, next we're going to move to the motor portion of cranial nerve 5. This is the trigeminal nerve. I'm going to palpate the temporal and masseter muscles and ask the patient to clench their jaw and feel for normal activation. That is good. Next we'll move to the sensory portion of the trigeminal nerve. We're going to do light touch to bilateral forehead, and this is the ophthalmic branch. The trigeminal nerve, light touch to bilateral cheeks, and that's testing the maxillary branch for the trigeminal nerve, and then light touch to bilateral chin, and that's the mandibular branch of the trigeminal nerve, cranial nerve 5. We did cranial nerve 6, we're going to move on to cranial nerve 7. This is the facial nerve. We're going to check the motor function first, so if you could raise both eyebrows. Very good. Clench your eyes shut, and I'm going to try and pull those apart. Don't let me pull them apart. Okay, very good. Let me see smile and frown. And can you bare your teeth? Okay, very good. And puff out your cheeks. Okay, very good. That is the motor function for cranial nerve 7, the facial nerve. Next, we're going to check the sensory function of cranial nerve 7, the facial nerve. We're going to check 4 senses to the anterior 2/3 of the tongue. The first is salty. Very good. Next we'll give something sweet. Very good. Something bitter. And finally something sour. Okay, that's all good. That was the sensory portion of cranial nerve 7, the facial nerve. Moving on, cranial nerve 8 is the vestibulocochlear nerve. We're going to check the cochlear portion only. We're going to do this by rubbing our fingers about 40 centimeters from the patient's ear. And tell me if you can hear that. Okay, good. Next, we're going to do a Weber test for lateralization. We do this by hitting the tuning fork and then placing the tuning fork on the middle of the head and say, do you hear it more to one side or in the middle? They should hear it in the middle. And next we're going to also do a Rene test to compare for air conduction and bone conduction. So hit the tuning fork, Hold it out to the ear. Can you hear this? Yes. And then put it on the bone. Can you hear this? Yes. And the air conduction should be louder than bone conduction. Next, we're moving on to cranial nerve 9 and 10, the motor function of the glossopharyngeal and vagus nerve. I'm going to ask the patient to say "ah," and we're looking for midline uvula and symmetric raise of the soft palate. So, ah. Okay, that all looks good. And for the sensory portion of cranial nerve 9 and 10, glossopharyngeal and vagus, we're going to elicit a gag reflex bilaterally, and that should be normal. And then we're going to check cranial nerve 10 alone. First, check the motor portion. We do this just by listening for a hoarse voice, which would indicate vocal cord paralysis. And for the sensory portion of cranial nerve 10, the vagus nerve, we're going to use the wood end of a Q-tip and test for sensation to the posterior portion of each ear canal. Good sensation. Good sensation. That's cranial nerve 10. Okay, cranial nerve 11 is the accessory nerve, or the spinal accessory nerve. We're going to test this by have the patient lift their shoulders up against resistance and then turn your head each way against resistance, and that should all be normal. That's the spinal accessory nerve. And finally, the hypoglossal nerve, cranial nerve 12, we're going to have the patient push their tongue against their cheek, through their cheek against the hand. Okay, that's good. That's good, and that conducts the cranial nerve assessment.